Okay, let's get started. I'm very happy to be running this Global Arch webinar today. My name is Amy Verstappen. As most of you know, I'm the president of the Global Alliance for Rheumatic and Congenital Hearts. Today we have with us Dr. Dominique Vervoort. He is currently a student of public health and business administration at Johns Hopkins, and he is also a Global Arch board member. He is the co-founder of the International Students Surgical Network, and he is a passionate advocate on behalf of cardiac access for patients and families in low and middle income countries. And he's also very skilled at leveraging social media for advocacy and interaction. So we were very excited to invite him to speak to us today about this. A little bit about the session today. You can type questions wherever you want, but Dr. Vervoort is going to answer them at the end. And after he's done, we're going to change the settings so that all of us can see each other. It's going to be a small session, as we like at Global Arch. We like it, to be a conversation among our leaders, or that's a real advantage. And so you will be able to see each other and talk to each other after the presentation is over. So Dom, take it away.
Great. Thank you so much, Amy, for the kind introduction. And hi, everyone. Thank you for joining so early. As mentioned, I'll be speaking today about the use of social media for both high-level and patient advocacy. And this is a topic that's very dear to my heart, given the use of social media in my daily life, but also having been using social media for specifically global surgery advocacy for the past many years. My talk will mostly be about high-level advocacy, so really to try and emphasize how we can use social media to influence policymakers, influence decision makers, influence funding bodies, etc., to push certain agendas on the global health agenda, and in this case, and specifically in terms of rheumatic and congenital heart disease. I have nothing to disclose other than the fact that I just really like to tweet. So I have a bit of a bias in terms of some of the things that I will say, but there's clear advantages of using social media for a variety of reasons. We live in an era where there is global connectivity. Over 40% of adults, almost 50% of the world's population in the next few years will have or currently has a smartphone with internet connectivity. And almost 3 billion people use social media accounts for a variety of reasons. In medicine and public health, social media and social media platforms have been used for a variety of reasons, and have been used, for example, for disseminating information related to public health campaigns or scholarly dissemination of scientific publications, to network, to find like-minded people, to make people aware of the most groundbreaking research results or public health interventions. And I think these days, in terms of COVID-19, this is definitely something where we're seeing the benefit of disseminating important groundbreaking information and ensuring that everybody's aware of the same public health interventions at a given point in time. Now, more broadly, social media is not just used to advocate and to network, but also in terms of more distinctly in terms of an advocacy perspective, also to ensure that we're priming individuals who are seeing our messages and making them more aware about topics that they might not have been aware of previously or have had some misconceptions of. Now, the benefits of social media are plenty. It's asynchronous, so it doesn't matter at what time you post. If somebody else reads that post 4 hours later or logs onto social media 4 hours later, they're still able to see that post, so it's not necessary to be online at the same time. It's universal. When I tweet something or post something on Facebook here today in Belgium, Amy in the US and somebody in Australia might see it at the same time or any time during the day. It's instant, so whenever I post something, people can see it immediately, and it's participatory. It lowers the threshold in terms of discussions, and people can participate regardless of what their background is. And with that, there's a lot of benefits for social media to really give everybody a voice, to ensure that we're informing people rightly, to ensure that we're persuading the people who we want to persuade, and eventually catalyze action and move to action by the respective stakeholders. Now, during the past 2 decades, social media obviously has boomed around the world, but has also been used for social change. Great examples in the past have been the Arab Spring and the Japan Tsunami Relief Fund, where social media has quickly disseminated information and brought people together to really take action and address issues at hand. And currently with COVID-19, we see similar situations happening where information regarding COVID-19 and the outbreak, as well as public health campaigns, et cetera, have been disseminated quickly to ensure that everybody's on the same page and is aware of what the exact public health measures are to take. Now, there's various social media platforms, and I'll quickly run through Facebook and Instagram to kind of give a complete picture. But eventually I'll be talking mostly about Twitter, given the fact that it has specifically for high-level advocacy some distinct advantages over other platforms. Now, in terms of Facebook, just as a couple of tips and suggestions, it's very important to know who you're talking to and who your audience is. As a patient and family organization, you are most likely going to be reaching patients and families, and so your messaging and your communication will also be tailored towards that. But for some other organizations or for individuals, it might be that they are reaching different generations, reaching different people from different backgrounds, might be reaching students versus healthcare professionals versus the general public versus politicians, et cetera, et cetera. And so it's very important to know who your audience is to ensure that you can tailor your message accordingly. With Facebook, but also with any kind of platform, really, it's important to also try and be multilingual in terms of the messaging and the communication that you're disseminating, which is especially important because even though we also in this webinar, obviously, are using English for a lot of our communication, not every communication might be seeping through to the same extent as if we were to translate it in different languages. As a third point, link. It's always very convenient with platforms like Twitter and Facebook to add hyperlinks, whether it's to your own website, to a YouTube video with more information, to an article, etc. And it's definitely something to take advantage of, as well as to use videos and visuals for people to grab their attention, to catch their eye when they're scrolling through their Facebook feed, to ensure that they have seen it and to be sure that they have also have their attention drawn to whatever you're saying. Similarly with Instagram, again, catch the eye. Instagram is a platform that mostly uses pictures and videos to grab people's attention and is less so focused on the verbal communication or the written communication. And so with this, the use of infographics, use of pictures of in-field experiences, etc., is very critical with the use of a platform like Instagram. It's important to be consistent. Try, if you're using Instagram from an advocacy perspective, to be consistent in your publishing rather than posting 10 pictures or 10 posts in one day. Try to spread them out once per day or once per week, etc., as opposed to having quick binging on Instagram once every month or so. Please use your story literally. Instagram and now also Facebook have the opportunities to use stories as a very short-term insight into what you're doing currently. So for example, you can take a picture or a video and share it with your following so they can see what is live happening and for them to also have a sense of what, for example, the organization is doing on the ground or at that given point in time. Also, just like with Facebook, feel free to shamelessly plug. You can add your link to your bio, also to post, but it's harder to click. But also make sure to plug whatever the organization is doing to make sure that whoever is seeing it is also fully aware of what is going on. Now, I will speak mostly about Twitter in the rest of my slides and the rest of my presentations, and that is because I consider for high-level advocacy Twitter as kind of the holy grail for high-level advocacy, and that is because of a variety of reasons. Now, specifically for high-level advocacy, policymakers, funders are mostly active on Twitter. Some of them are active on Facebook or even Instagram, but the highest chance of reaching them and the highest chance of getting their attention will be on Twitter, as well as for media being very much present on feeds like Twitter. Unlike Facebook, where you really have to connect with people, where you have to make sure that they are either friends of you, follow your page, or in a Facebook group. With Twitter, if somebody disseminates or shares your information or your post, it's much more likely to be picked up by other individuals as well. And high-level meetings, so meetings where high-level bodies such as, for example, the WHO, ministers of health, large NGOs, etc., come together. There's always high presence of media, high activity of media on social media, and also gives you an opportunity to advocate for something more widely at that point in time, given the fact that everybody is simply online during that moment. And then third, fourth, and fifth is that social media can be used as dissemination of information, simply to communicate whatever you have to communicate, but also to network with like-minded individuals, like-minded organizations, like-minded policymakers who have an interest in whatever the work is that you're doing or advocating for. On the right, you see a tweet that I had sent out during the World Health Assembly in 2018, where I brought attention to, at that moment, sorry, it was 2019, brought attention to, at that moment, an update by the Director General of the World Health Organization, Dr. Tedros, on the advancements in global surgical obstetric and anesthesia care from the perspective of the World Health Organization. And it was a very pivotal moment, a very strong win for the global surgery community, because it was a 2-page summary. And I used this as a way for people to draw their attention to not just the summary and the attention that the WHO at that point in time was giving to global surgery, but also to, below that, show them in 100 tweets why we actually should be caring about global surgery for a variety of reasons. High-level advocacy can also be seen through very other means, or at least the success thereof, of social media. This is Richard Horton. On the left is his tweet that he sent out prior to the World Health Assembly. Richard Horton is the editor-in-chief of The Lancet, and before coming to the World Health Assembly in Geneva, he asked his following: if you had 10 minutes to speak to all the 194 member states at the World Health Assembly, so all countries with a representation and a Ministry of Health present at the World Health Assembly, what would you say to them? What is for you the most important thing to address? Now, this seems something very trivial, but Dr. Horton actually went up to speak to all of these 194 member states and addressed them formally during the opening of the World Health Assembly. And he listened to what his following had to say. And he actually addressed a lot of these points to all ministries of health to make them attentive of this as well. And one of these things was also investing in safe surgical and anesthesia care, which again, for the global surgery community, but also for the CHD and RHD community, was a very pivotal moment as well, and really important for ministries of health to pay attention to something that they otherwise might not have paid attention to. Similarly, these are 2 tweets on the left by the WHO and on the right by Unitar, which is an agency of the UN, of the United Nations, and both draw attention to surgery as well. And while this seems very meaningless, because it's simply one tweet, one of many tweets, it's very important for people who see this, that they also associate organizations like the WHO, like the UN, like certain NGOs, like certain policymakers, like certain funders, with topics like surgery, or in our case, CHD, RHD, because most of the people who are following them typically don't associate these organizations with these topics or with these conditions or interventions. And so this is also a great example of priming, because social media can be used to actually prime individuals to think about things that they otherwise would not be thinking of. Now, Global Surgery Day is a day that's happening on May 25th every year, and is in light of the 2015 World Health Assembly resolution that focused on safe surgery and anesthesia care as a component of universal health coverage. And every year on that day, which is a day that is embraced by Incision, the International Student Surgical Network, a large social media campaign takes place in a variety of languages and a variety of means and platforms. Messaging takes place to really draw attention towards safe surgery and anesthesia care for everybody worldwide. And has been very successful in the past few years in really drawing attention by large bodies, large individuals, towards the importance of surgical obstetric and anesthesia care within global health. Over the past few years, Global Surgery Day has been embraced again by major individuals in different languages, and has really shown the success of using social media for widespread dissemination of important messaging, but also streamlined conversations and streamlined advocacy campaigns for a common goal. Now, the remainder of the presentation will be very straightforward for some, but hopefully also give some tips and insights into how to effectively use Twitter, and more broadly also social media to an extent, on other platforms for greatest efficiency and greatest efficacy. So this is just simply how to get started with Twitter. Simply going to the website and signing up. It's always good to have an easy to remember handle, just so that if you want people to follow you or your organization, they can easily retrieve you by looking for you. For you individually, for an organization, that will obviously be the organizational logo, but for you individually, it's always good to have a picture to be more personal and to be kind of addressing the people who are looking at your profile, but also to add a short biography so that both for yourself as for your organization, people know what your account is about, and kind of what the content is that you are providing. Typically with organizations, this may be their mission statement or their vision statement, as well as with a link to their website with further information. For those who are starting, it's always good to start with sending out your first tweet for really to make sure that everybody's aware of who you are and what's going on. And then the anatomy of a tweet is arguably the most important thing for those who are starting with Twitter, because it's very important to make sure that your messaging is reaching people. And for that, it's important to not just have words in your post, but also to be tagging people, which is shown by the handle, in this case on the left, Melinda Gates and the Gates Foundation, whereby you're tagging people so that when they open their account, they can see that you've posted about them because you've added their handle. The hashtag, in this case, hashtag CHD for congenital heart defects, allows people who click on that hashtag to find common posts with that hashtag and ensures that people who are talking about the same thing can also find each other and can also echo and elevate each other's posts as well. It's important to be concise. People see hundreds of posts when they're scrolling through their Twitter feed or Facebook feed, etc. So try to be as concise as possible, but make sure to be comprehensive because you always want to make sure that people understand what you're writing about. Try to leave some food for thought and entice. In this case, obviously, I'm trying to get the attention of Melinda Gates and Gates Foundation to bring more attention towards congenital heart defects. So with this, I'm hoping to get their attention and having them reply. Unfortunately, they haven't yet, but hopefully one day they will. But also for other readers, for them, they also really understand what this message is about because I give some background information while still leaving the stage open for further discussions. Try to use visuals. Visuals are always very effective in getting the attention of individuals by approximately double the amount of time or double the amount of chance that you have in terms of attention that you would get versus a simple word post. With this, the picture that I used was a screenshot by Melinda Gates' Facebook account where she talked about a book that she read about congenital heart defects and how she found it very moving, but that she didn't really talk further about what we should do to address this issue, especially given the fact that she has a major background in terms of the Gates Foundation and the foundation that she represents. Even with the picture, you can also tag individuals. You can tag up to 10 people so that more people see it, not just in your text, but also behind your picture, so to say. Brings also more attention towards others. And for those who are more interested in kind of the nitty-gritty details of what the attention is, they can click on the bars at the bottom of your post where you can see how many people have seen it, how many people have clicked on it, how many people have liked, retweeted, etc. And so this really allows you to understand to what extent this is trying to, or at least successful in engaging people and impressing people through the number of engagements as well as impressions of a certain post. Some general advice, I think that most people are aware of this, but how not to tweet is try not to use too many hashtags. Obviously, hashtags are helpful to really draw attention to something or for people to find common goals or common voices, but try to limit it because too many hashtags are also very difficult to read, but also try and be grammatically conscious. You don't want to scare people in terms of coming across as if you're, for example, shouting by using all caps and things like that. So try to use it as if you're sending an email or writing a blog post or things like that. Then how to tweet during the year. Again, same tweet on the left, just as an example. But obviously, it's important to stay up to date with what's happening in your field or for your organization and your partners, and etc. Try and let your followers know what is going on. Keep them informed, especially for advocacy, whether it is for your members or the people that you represent or the people who are on your organization, as well as for high-level advocacy for funders, policymakers, etc., who are getting an increased attention or increased interest in the work that you're doing or the work that you are presenting. For them, it's important to keep informed or to stay informed with what is going on. Try to provide new content, especially if you add a personal story or an opinion that's very important. So with this on the left, obviously I regurgitated the information of what the WHO was saying about improvement in access to surgical obstetric and anesthesia care. But I added my personal opinion or my personal story to it by creating a 100 tweet thread with different reasons of why we actually should be caring about global surgery within global health through my own opinion based on evidence as well as personal experiences. Try to partake in Twitter chats, and Twitter chats on Twitter are ways where people come together during, for example, half an hour or an hour and discuss certain topics or discuss certain questions or publications. Try to engage with others as well. Try to not just post things from your own, but also try and like, retweet, comment on what other people are saying, and specifically tweet at high-level accounts. Try to reach the people that you really want to reach. In my previous post, that was, for example, Melinda Gates and the Melinda Gates Foundation. In this post, it is, for example, Dr. Tedros and the WHO. But in your case, it might be a certain funder, it might be a policymaker, the minister, et cetera, et cetera. So if you really want to get their attention, also try and tweet towards them, try and tag them and make them aware of what is going on. And then lastly, also try and share insights from the field. Obviously, make sure you have permission locally, especially if you're taking pictures of individuals, of patients, etc. So always make sure you have that permission. But it gives a nice twist or a nice addition to a certain post so that people are really seeing the impact of what you're doing. At events, it's a bit difficult now with the current pandemic, but hopefully things will soon improve and we're able to go to events safely again as well. But this is just as applicable for example, webinars or virtual conferences, is making sure that people are aware that this meeting is going on, letting them know what the meeting is about if they're not able to attend. And you can do that, for example, by citing whatever the person who is presenting or speaking is saying. In this case, disposed by the Harvard Program in Global Surgery and Social Change, cites what Dr. Tedros said about surgery and anesthesia care within universal health coverage, and is really tweeting ad verbum to ensure that they are not twisting the interpretation, but are really citing what the person has said. Again, try and take a picture. It really improves the attention that you would get because people are more likely to see it when they scroll through their tweets. Try and tag the speaker and other relevant accounts as well. So for example, in this case, make sure that you let Dr. Tedros know that you've seen it, but with others, it might be a clinician, it might be a patient advocate, it might be a policymaker somewhere locally. So they can also see, oh, they're interested in what I'm doing, and they're also trying to elevate the message that I'm trying to share, which enables, again, networking as well as future discussions. And then if it's a conference or if it's something that has a common hashtag, trying to use that as well, because this allows people who are also at the conference or webinar or meeting to network and see what you're saying about that event as well when they click on that specific hashtag. This is more for in-person meetings, but if you're going to an in-person meeting, always make sure to be prepared. Make sure that obviously your phone or whatever you're tweeting is charged. Make sure you have your connectivity just so you can share instantly. And make sure that whoever is there, that you know their handles and their hashtags, just so that when you're tweeting, you're also prepared of what to say and you're not losing too much time in trying to figure that out. Some general Twitter tips and tricks, and this is also applicable to other social media platforms, but specifically and for Twitter here, is that it is okay to provoke as mostly as an individual, but also make sure to provoke wisely. For example, in this case on the left, this was in 2018, also at the World Health Assembly, where I really tried to address that we are talking about a lot of global health issues at the World Health Assembly. But that year in 2018, nobody was talking about surgical and anesthesia care from a high level perspective as opposed to the participants. And that was very shocking because there were a lot of things on the agenda that didn't have the same amount of impact globally, but that just had much more political or monetary engagement behind it, which is how it came on the agenda. On the right is a way to simply attract readers. Try for them to also make sure that they have something new to read, that you're not just sharing information that they can simply find by, for example, clicking on a link, by copying everything, or by, for example, summarizing a specific point of a certain publication or a certain video or a certain insight or post that you want to share. Twitter lists are specifically helpful for you to kind of categorize who you're following. It allows you to say, for example, I want to follow global surgery accounts, but I want to make sure that I can easily follow them. So you give them a global surgery, you add them to a global surgery list. For CHD, you can make a CHD list. For RHD, you can make an RHD list, et cetera, so that you can also more easily find them again, and more easily elevate their discussions as well as add your personal handle to that list. On the right, Twitter chats, as mentioned previously, are very convenient ways to engage with other people and discuss certain points and specifically draw attention towards the topic that is being discussed. So this is a picture of Global Surgery Day. So it was, of course, about using basically global surgery within universal health coverage, but a Twitter chat might also be about the impact of congenital heart defects amongst patients and family organizations or patients and families themselves in your local community or on the global health agenda. It might be about the impact of rheumatic heart disease within global health and how that is being addressed. So the topics come vary widely, but it is a nice way for people to come together and really discuss it, not just through for example, a Zoom call, but really just through social media posts where everybody who's online on Twitter can also see it. And then lastly, just as some general pointers for those who really want to get deeper into the details of Twitter and Twitter analytics, as well as to be more effective in terms of their organization's posts and communication, is that you can use TweetDeck at tweetdeck.twitter.com, which is a free platform by Twitter itself. It allows you to schedule posts, that allows you to categorize posts per account, etc. And it's very convenient because if you, for example, as an organization aren't able to post personally every day or every few hours or so or every week, you can simply schedule those tweets to be sent out automatically at a certain point in time. And it gives you a bit more flexibility in terms of scheduling this and doesn't need you or your social media manager or whoever is representing you on social media to do that at a certain moment. Hootsuite is similar to that extent, but also allows you to integrate other social media platforms such as Facebook, Instagram, etc. For example, to cross-post instantly across all different platforms. However, Hootsuite is not free if you want to use it entirely, so that's something to take into account. And then lastly, Twitter Analytics is a free tool, but is only for Twitter, as the name suggests, is also by Twitter itself. It allows you to more granularly see how your account is doing in terms of performance, in terms of how many people have started following you, how many people are seeing your posts, what has been your most successful post, and has it been reaching, for example, people in a certain world region versus another, so that you can also identify which of my target audience am I not reaching, or am I actually reaching the audience that I'm hoping to reach. And with that, you can kind of tweak either the timing of your posts or the content of your posts or the people that you're tagging, etc. On the right, and this is important both personally as well as for an organization, is to make sure that you assume that everything you post is permanent. So always make sure you take some time to double check what you're tweeting before you're sending. If you're sending, whether it's intentionally or accidentally, something hurtful or something that has been misquoted or something that is twisting a certain message, people might see it instantly when you tweet it. It might have taken a screenshot even if you delete it. So assume that everything you tweet is permanent on Twitter or on any kind of social media platform, and make sure you double check what you're writing about or what you're saying before you tweet. Try and engage more than you distribute is a bit of a rule of thumb. try to retweet about 3 times as much posts from other people as you're tweeting, so that you can also show that you're not just trying to disseminate information from yourself, which is very important because that's why people are following you. But I also have the feeling and also the true feeling that you're also interested in what they have to say. You're also trying to engage with them and sharing the messages that you or that they are providing. And then lastly, something that I've mentioned before as well is don't just regurgitate, share your thoughts. People are following you because they're interested in what you have to say or what your organization has to share. So try to give a personal twist to that as well, whether it's a personal opinion or sharing something that is similar to what is being shared. For some overall more info in how to use social media, but specifically Twitter for more effective social media reach and impact is a bit what elaborates on what I've currently presented. And specifically for the global survey community with a lot of points that are applicable for anybody really, is this an ebooklet, a PDF that is freely available online should you be interested. And one last thing is that obviously this is a Global Arch webinar, and as a board member of Global Arch, I'm also hoping that you will be following Global Arch on Twitter if you're not already doing so, and that you also can engage and distribute the information that we're trying to provide representing patient and family organizations for rheumatic and congenital heart disease. So that's it. I'm happy to answer any questions that you might have, and I'm very grateful, very thankful for you all to attend and also to be willing to learn more about social media and using that as a powerful advocacy tool.
Thank you, Dom. That was wonderful. As I said, I am going to be allowing people actually to come in as panelists so we can see each other while we speak and ask questions. Mm-hmm. So let's see. I'm just going through everybody. I think we're all going to fit. Okay. And I believe that everybody should be able to unmute themselves. Let's just make sure that's true. I believe so. Beaster, are you able to unmute yourself? Yes, okay,
I am.
Great. All right, what I'd love to do, if people have questions, I invite you to put on your video if you like. We have a bunch of great people here. I want to start seeing who has questions for Dominique. When you ask your question, if you could say your name first and where you're from or what your organization is, and then ask your question. If you're feeling shy and you don't want to turn on your video and you don't want to speak, that's fine. And you can type your questions in the chat bar or in the Q&A. So good morning. Who has any thoughts or questions to add?
I have a question for Dom.
Okay, can you first start and tell us your name and what organization you're from?
My name is Shloni Bukhalani, and I just finished at Johns Hopkins. I was studying with Dominique.
Okay.
So I'm currently back in South Africa and going back to my residency position at the hospital here. My question to Dominique is in relation to, you spoke about not too many hashtags, not too many capital letters when you're speaking, sort of to try and convey a type of tone. How do you convey tone when you might be tweeting from a point of feeling very impassioned about what you're talking about, but you're neither shouting nor are you being mean or ugly or malicious?
Yeah, that's a very valid point. And it's a bit of a fine balance because obviously it depends on who you're representing. Obviously, as for example, an organization, you would arguably not trying to be pushing a certain argument or so in a potentially rude or or malicious manner. Whereas as an individual, it might be that you're getting into a heated discussion and you really want to emphasize a certain point. And sometimes people use capitals. I think if you're really trying to address something where you're trying to emphasize, okay, this is not this, then it's okay to capitalize not, or put not between two asterisks, just so that people see, okay, he's trying to put the emphasis on this specific word or this specific argument. But in general, obviously, Twitter, even though it's a social media platform, people are using it for their personal means, is not an excuse to be rude or hurtful in terms of your discussions or in terms of your arguments, especially if you're a clinician or if you're representing an organization or if you're representing a company or so. You want to be as professional as possible, because you're not going to win an argument if you're not professional. But it's okay to really certainly kind of convey your dismay about a certain point. For example, a public health measure that is being taken by your government, if you're not agreeing with it, then you can simply state what your argument is against it and also build that in terms of evidence. And that's totally okay.
Thank you. Thank you very much.
Excellent presentation, Dom. You certainly master how to use social media, and one thing that I wanted to add is that
first, you're going to say your bistro. You're going to say your name and what organization.
Sure. Sorry.
And where.
Apologies. Bistro Jeleva with Children's Heartling. That LinkedIn is another platform that I have seen a lot of people use in a very similar fashion, like Twitter. And I see it, unfortunately, because you wish everyone was in the same platform, but I see that there's different groups of people who tend to use all of the social media platforms differently. So I don't know if you have a comment about that.
Yeah, that's a great point. I did not intentionally leave out LinkedIn, but LinkedIn is, from an advocacy perspective, is less used, mostly because LinkedIn tends to be a professional platform that people use to represent themselves, for example, as their CV or to find job opportunities, etc. But obviously, there's a lot of organizations, whether they're seeking for people to join their organization or to be employed or simply to share information in a similar manner as you're using Twitter. So it's definitely, a lot of this is very applicable on LinkedIn as well, especially because on LinkedIn, people tend to use it in the same way in terms of sharing pictures, using hashtags, tagging people, etc. So a lot of these lessons are applicable as well. It is just said specifically for high level advocacy, thinking, for example, advocating for a certain point at the World Health Assembly. Media and organizations, policymakers, they tend to be very focused on one platform as opposed to being present on every single platform.
Thank you. One thing that I've noticed is that LinkedIn is used by, if you want to, in a very similar way, I agree those organizations tend not to use LinkedIn, but is used by key opinion leaders and like professional functions. So if we're talking about health and medicine, a lot of people actually do use it. And so if you want to grab some of those people's attention, it's a very useful way.
It's very true, especially because for those who are not aware with both platforms, Twitter has a 280 character limit. So you're only able to say as much in 280 characters, whereas LinkedIn, just like Facebook, just like Instagram, allows you to write almost as much as you want. So if you're trying to really build an argument or write an essay or something like that, similar to a blog or an op-ed or an article, then platforms like LinkedIn are much easier than, for example, Twitter.
Other questions? I certainly have a number of questions. I'm Amy Verstappen. For those of you who heard at the beginning, I'm the president of Global Arch. So I just recently started tweeting, even though I've been in the advocacy biz now for 25 years because I'm old. And I have all these very basic questions. So a lot of what you said was really helpful. So the first one is, how much time, realistically, like if I'm making a schedule for myself, how much time is the minimum time that, let's say, an organizational leader or somebody at an organization should be looking at and responding to tweets. So it doesn't have to be me, but like at Global Arch, if we're going to say, okay, we got to do at least X, what's a realistic assessment of that? And then the other question is a little different, which is I notice now when I look at tweets, there's a funny interface between people's professional self and their personal self, right? So I came into Twitter to represent Global Arch. I am a congenital heart patient. And it's interesting because the things that have gotten the most pickup have referenced both the professional organization, but a little bit funny or a little personal. And that's what I'm trying to figure out, because even people like Atul Gawande tweets about his kids sometimes. So this is what I'm trying to figure out, is like this nuance between being a person and how to be, you know, I know how to not be mean, but that sweet spot of being engaging and a little bit personal, but not too much of that.
Mm-hmm.
Does that make sense?
Yeah, it does. Those are two great questions. Specifically for the first one, so obviously every minute that you spend and try to engage with people or trying to disseminate information is a minute gained. With one big caveat is that Twitter, just like any social media platform, can really absorb you, and you can really go down the rabbit hole and spend hours and hours and hours on it. So obviously you want to kind of find a balance between, okay, how much time do I have and want to spend on it, or at least from a maximal time perspective, versus, okay, if I spend, for example, 5 minutes on it, I can retweet a couple of things, I can like a couple of posts, maybe I can tweet or share a certain insight from what the work that I'm doing or my organization is doing. But from an organization perspective, specifically, it's always very handy to be very consistent in your messaging, because otherwise people might be thinking that your organization is not as active anymore, or that nothing's actually happening. And so from an organizational perspective, things like, for example, TweetDeck, where you can schedule your tweets, are very handy, because it makes sure that you're not forgetting and you're not having to spend your time on Twitter every single day. In terms of the second point, second question, it's social media to an extent is not different than from our real life engagements. So if you, for example, meet Atul Gawande in real life, he will be the same if he kind of knows you in terms of how he makes sometimes jokes, how he shares some insights from his personal background, etc. Because that's what he does in his public writing as well, in terms of his blogs, his op-eds, his books, etc. And so in a lot of ways, how people communicate on social media tends to be similar to how they are in person, unless they're trying to be anonymous for typically not so good reasons. But for public profiles, etc., that tends to be very similar. In terms of finding the sweet spots, there's people who really try to stay fully professional, not make a single joke, not share anything personal on their social media. That's totally fine. That's their own personal preference, as well as people who are, for example, sharing more insights into, for example, this is a picture of my kids, a picture of my dog, etc. And that's totally fine as well. What some people do, and it's also just a different twist to it, is that they make two accounts. One of them is actually their hat of, okay, I'm this top leader or I'm representing this organization, versus their personal account where they say, okay, I'm just sharing my political opinions, or I'm sharing funny thoughts and things like that. So it's really a personal preference, but a lot of that is also simply just how you engage with people in real life, and just bringing that to verbal or written communication on Twitter or any other social media platform.
That's very helpful. I guess when I hear you say that, it makes me think about just social capital. Like, you know, my experience as a leader of an organization is so much of it is relationship building. So that helps me think about it, that if I'm supposed to be the same as I am in real life, then that would be that same thing, that you want people to have a sense of who you are and have a personal connection within the realm of not too much information and appropriate. That's kind of it, right?
Yeah, exactly.
Because it's a new kind of relationship, a relationship through Twitter.
Yeah, exactly. I mean, the nice thing, and that's actually how I met a lot of people as well in my fields of interest, is that oftentimes people tend to meet you first on social media before they meet you in person, oftentimes because they either see what you've posted at a certain conference and they see that you're there as well, or they know that you're advocating for a common thing and you just happen to be at the same meeting. And if you're actually meeting people in person, it's good to be the same in person because people know what to expect. But people also find those commonalities in terms of personal traits, in terms of how approachable you are as a person or as somebody representing an organization, which obviously in terms of high level advocacy, in terms of connecting with policymakers, funders, other organizations, is very important to really keep that kind of same charisma or personal connection and social approachability as well.
I want to invite anybody who has not asked a question to ask a question. Any other thoughts? I'm looking at a lot of little black boxes, so I'm assuming people are feeling shy this morning, which is fine. Any other comments? I would love to also hear about other organizations' experience with Twitter. If anybody has an experience they've had where it's been successful or where it hasn't been successful.
I have a question and kind of interested in comments from people about deliberate misinformation that often exists on social media, and any suggestions on how to deal with that and how to sift through what's true and what's not true, what's an opinion and what is actually a real fact. So I think that that's a very useful skill to build as you're using social media, because there's a lot of things that you have to, what is your strategy for vetting, basically, is my question.
Yeah, I'll give my perspective, but I'm also very happy to hear everybody's thoughts or whoever wants to reply. But that's unfortunately a bit of the flip side, is that social media is used for a variety of means. And for some people, it might get political, or some people, they just have a very strong opinion for something that they might not necessarily be correct about, or not necessarily have formally informed themselves about. And I think the current situation with COVID, with a lot of potential treatment modalities, with using or not using masks and things like that, unfortunately brought up very divisive camps, and that's not helpful in cases with an outbreak, etc. But it's similar in terms of kind of advocating for surgery on the global health agenda, the importance of care for CHD and rheumatic heart disease on the global health agenda. There's always going to be different opinions or people who have a different interest and are trying to push a different agenda. And so for anybody really, regardless of what you're talking about, obviously try and inform yourself beyond just one single post or two Twitter posts or discussions, and try to also see who's talking about it. If it is, for example, the WHO or health minister or so, you can assume that they have at least had their background reading or background information from committees or just people who are informing them. If it's a personal individual who doesn't have their personal picture or who has very divisive slurs on their social media feed, then arguably you should be a bit more cautious. But in general, obviously, watch out with how much information you're accepting immediately on social media, depending on who it's coming from, and always make sure that you're vetting it based on independent or neutral sources online or simply other accounts.
A follow-up question on the facts and opinions. I know that when I'm on Facebook, I always go, there's something, at least in the US, called Snopes, which is great. Like you can immediately look things up. What are the other like specific websites or tools I know, or you can type in fact check. Most of the times I do that, though, it's about sort of the political realm. I know I tell people to go to the WHO and the CDC websites, things like that, although unfortunately the recent experience is that there's been, I think, a lot of the faith in both of those organizations has been undermined. So for example, with the WHO having to be pushed to talk more about the possible aerosol, transmission and the mask issue. So where are other, is there good places for people to go specifically for public health or research information, to get checks, to look at information that for anybody on the call knows about?
Yeah. So from kind of a website perspective, similar to Snopes, I'm not aware of any kind of common websites existing, really depending on the topic. Obviously, you'll have websites that are specifically dedicated to that. I think especially pertinent to COVID, it's a bit of a tricky situation because a lot of things are still unknown. And so for top leaders, major organizations, et cetera, occasionally they have to give a certain opinion, and it might just happen that a month or 2 months later, it happens to be the other end. So that's a bit of a tricky situation. But in terms of just vetting information, obviously, if on your board or on your organization or in your immediate background or you're personally yourself are able to take a more critical look to it academically speaking and try to seek whether there's any information from credible sources such as, for example, systematic reviews, meta-analyses, et cetera, that are really higher level evidence in the scientific realms, that would be great. If that's not the case, depending on what the topic is, you might be reaching out to major thought leaders or major organizations specific to that. Specifically for here, RHD, CHD, it might be a cardiology or cardiac surgery professional society who's putting out guidelines specific to that, because typically they have focus groups or expert groups, et cetera, that are really trying to trim down every single thought opinion or thought piece of a certain situation to make sure it is as concrete and as applicable as it can be with little ambiguity. And so depending on what the question is at hand from a public health measure or a clinical perspective, those could be very valuable tools to use, being guidelines or recommendations by such societies.
Great, thank you. I think, yeah, in my experience running a patient family organization in the past, our basic, very solid rule was we as a patient organization never expressed an opinion about any kind of clinical or issue unless it was something that had been come out from the professional societies, guidelines, research, things like that. We're really, really clear that that was the only information we wanted to be putting out. And I know that we had sort of a short list of other sources that we would look at. So it sounds like there might be a role even in having some board discussion about their communications committee, coming up with just some rules just to make sure that in the heat of the moment, somebody doesn't do something without planning to, sort of like, what you were saying about taking that 2-second pause, making sure as an organization, you're very aware of the issues that can happen when you retweet something that isn't from the right place, right? Other questions or comments? Well, Dom, that was excellent. Thank you so much for doing that. That was great. And thank you all for being here. And we look forward to seeing you at another Global Arch Leaders Forum soon. Thank you.
Thank you all.